Hello, welcome back to visionscienceacademy.org. Today, I am Somay Hedarzadeh on behalf of VSA team are hosting you, and we have special guest Natasha Wilch. For those who doesn't know her, I would like to say Natasha is a registered physical therapist, speaker, and entrepreneur. The heart of everything she does is to benefit and be impactful to those around her. Professionally, Natasha is the owner of Symphony Rehabilitation, a multidisciplinary rehab clinic with special focus on the concussion and neurological population. She's also the co-founder of Concussion Compass. It's an online membership community for individuals living with post-concussion syndrome. Symphony Rehabilitation was one of the first clinics in Canada to begin to offer virtual service. When she had to close her doors in March 2020 due to pandemic, she didn't disappointed like many of us. She actually quickly realized that she had the tools to help other business owners service. So since March, she has coached over 500 clinic owners in their transition of their brick and mortar services online to the telehealth space. There are a lot to tell about telehealth space, which Natasha gonna cover everything in detail. But what I would like you to know that her passion for mentorship, her ability to think outside the box, and desire to make an impact had led her to being Canada's Entrepreneur of the Year for 2017-2018 Top 20 Under 40 Business and Community Achievement Award, RBC Woman of Influence, Top 400 over 8,000 micro businesses, and this year's Physical Therapy of BC Excellent in Leadership Award. Wow, such a successful woman. Welcome, Natasha.
Thank you so much for having me.
Thank you so much for being here. Our audience are just waiting to just listen to you.
Okay, so I'll take over the screen share if that's okay. So I made a PowerPoint and then for a moment had a panic because I couldn't get my PowerPoint to load, but we are working now. So we're just gonna bring this up.
No worries.
And then my question would be, can you see this screen? So do you see
Yes.
the PowerPoint? Perfect, okay.
Yes, very clear.
So,
already.
We're gonna chat a little bit this morning. I'm gonna work through this presentation. I'm gonna give you an overview. So the worlds that I love are telehealth and concussion. These are two of the things that I have dedicated my career to. It's two things that I love to speak about. And the fact that I get to talk a little bit about optometry today is always interesting from a physical therapist standpoint. However, being at the Vision Sciences Academy, that made sense. And I work closely with several optometrists in my town as well, because in the world of concussion in particularly, it is a very multidisciplinary approach to care. And the more I feel that our professions can understand each other, the better we can support our clients. So we're going to I have about a 30-ish minute presentation planned. We're going to go over that. And then I know we have some Q&A time at the end as well. So pending my thing wants to work, here we go. So these are the three things we're going to talk about today. So we're going to start with telehealth and we're going to go there a little bit first. Then we're going to go into concussion. And then we're going to go into optometry's role in concussion management from the way as a physical therapist that I understand it, and how my optometry colleagues and I have worked together to help our concussion clients as well. So why am I the person speaking to you today? So as you just heard, I am a registered physical therapist and I live in Western Canada. It is 7:05 in the morning for me right now. And I think it's the afternoon or evening for you guys, isn't it?
Sorry to disturb you. We really appreciate it.
So it is 7 a.m. on Vancouver Island where I am. But I love to speak. I love to be able to inspire people, and I love to be able to share knowledge with people who are interested in learning. And so some tidbits about me about why I might be the one speaking to you about these topics today are, number one, I am a concussion clinician and speaker. So I have dedicated the last, 5+ years of my career focused solely on concussion education, awareness, and treatment. And what that looks like from a physical therapist perspective is I've done continuing courses in things like vestibular rehab, clinical neuroscience. I have attended neuro optometry conferences to learn more from them as well. So I truly believe in this multidisciplinary approach to concussion rehab. And the better I can understand all our disciplines and how these things impact our person, the better I can be as a therapist and a colleague. So I've been doing that. I've been practicing telehealth since 2017. So I was, as you heard earlier, one of the first clinics in Canada to really try and make a go of it for private practice services. When I did it, no one knew what the heck it was. And by that, I mean, I would tell my own colleagues that I was doing and offering telehealth, and they would have no idea what I was talking about. Not a clue. So when I started this, there weren't any guidebooks, there weren't any frameworks, there was no place you could go to collect information. So there was a lot of hours spent researching, there was a lot of hours on the telephone. I will never forget one phone call in particular that I had with another college in my country that had said, Natasha, I fail to understand how you could possibly have our people's best interests at heart when you live in British Columbia that someone here couldn't have. And I was floored because that completely defeats the purpose of what telehealth is, right? Telehealth's goal is to increase access to care. And the reason I was reaching out to this one college in particular was because I'd gotten inquiry from someone in that province who their closest physical therapist was 5 hours away. So I had a lot of phone calls, I had a lot of conversations, I had a lot of people not believe in what I was trying to do and question how something that is a very physical discipline, for the most part, could possibly do things via telehealth. I still launched it, I still did it. And I launched in 2017. And that was the year, yes. So I won on Canada's Entrepreneur of the Year award for that. The awards that were shared with you that I've won, those have all been because of my role in leadership, in telehealth, and in concussion kind of education and awareness within my community. So that's kind of where all that comes from. Earlier this year, at least I'm pretty sure around the world, we had to close our doors, right? So we all went into lockdown in March. And my clinic was closed for 2.5 months. We were able to flip all our appointments into virtual appointments. And we were doing over 134 appointments a week virtually through my clinic. And so what I realized is that I had the ability to help other business owners. And so in March, I created an online course that's literally your step-by-step framework and guide to transition your brick and mortar businesses online. And I do have a special offer for you guys at the end of this presentation for that as well that I'll share. So that's why I'm here. So let's start about telehealth first. And I start every presentation with this quote because I love it. Telehealth is the natural evolution of healthcare. And this comes from Dr. Andrew Watson, and he's an MD at UPMC. And I love it because if you think about why you went into your profession to begin with, why did you become an optometrist? Why did you become a physical therapist? Your goal was to help people. That's why you did this, right? And whether you own your clinic or you own your practice or you're a clinician who's providing care, you also notice that you always do continuing education, you buy the newer piece of technology, and everything you do is to increase the standard of care that you're delivering to your clients. It's to help you get better diagnostics, it's to help you have better diagnosis, it's to help you understand what's happening more, it's to help you treat better. So telehealth is simply the natural evolution of that same process. It's introducing another vehicle of delivery for you to offer those exceptional services. So I love this quote. And apparently I make it really large. 1 second here. All right, so now we're going to go into what is telehealth. So this definition comes from the World Health Organization. So telehealth is the use of telecommunications and virtual technology to deliver healthcare outside of traditional healthcare facilities, extending the reach of high quality care and in-depth expertise to the home, as well as to remote and isolated communities. And I just love to emphasize one part of this paragraph the most. You're extending the reach of high quality care and in-depth expertise. So those of us that are providing telehealth, you are giving the same level of care, the same standard of care to your patients or your clients that you would give in person remotely. And that is so incredibly important. And that is a piece that every college out there, every association out there emphasizes, that if you're doing telehealth, the standard and quality of care needs to remain the same. So let's talk about where telehealth is today. So there was a big stimulus for change in March of this year. So like I said, before March, not many people knew what it was. It was, there weren't a lot of people that funded it. But in March, doors closed. And all of a sudden, you saw a rapid adoption of telehealth across multiple disciplines, right? So you started seeing, and where people are saying telehealth, they would also say things like tele optometry, telephysiotherapy, telepsychiatry, telemedicine, right? So people would literally take tele and then put in their profession in those parentheses. And across March, you saw almost every profession shift a little bit into an online virtual space. Not only that, at least in my country and in the United States, there was improved funding access. So extended health insurances or Medicare in the US, or people that normally wouldn't have funded telehealth services and reimbursed their patrons, I guess, were now doing that. So it decreased that barrier and made it more accessible. There was improved awareness. So again, when I talk about before where people had no idea what the heck telehealth was, everybody started to know what telehealth was, right? Everyone knew what virtual services were. Everyone was offering it. It was everywhere you looked. And then there continues to be, and there was development of technology to support virtual care. And we are seeing more of this, and we're going to continue to see more of this. That's going to allow us to keep getting objective data from our clients from a remote access. So let's talk a little bit quickly about some of the 4 major benefits of telehealth. Number 1 is improved access to care. And I mean this both in terms of location and time. So example, I live on Vancouver Island, right? And so we're a smaller town, and to get to us, you need to fly or take a ferry. And British Columbia is a pretty big province. And I am licensed to practice in my province as well as the Northwest Territories and Nunavut. So now via telehealth, I can help clients throughout my entire province or those territories. They don't need to physically be in my location. So for somebody who has either an interest in a specialty or just in general, it improves your ability to help people in a wider geographical area. Not only that, the timing is usually can be faster. So again, because we're on concussion, let's talk about concussion. We know the research supports that the sooner we can have people assessed by a medical professional, the better we can support them in that acute phase. There's a decreased likelihood that they will develop persistent concussion symptoms. Now, if you look at some of these remote communities, at least in Canada, for someone to see a concussion specialist or someone who is trained more in concussion, that could take weeks or months. They'd have to arrange travel. They'd have to be able to get there. But telehealth allows them to connect with people so much faster that they can get started quicker. And their chance for recovery, a smoother recovery, will happen more successfully. So there was a study done in Canada, obviously looking at one of our provinces, Manitoba, and they found that this was exactly what they did. So they had a remote northern community, and they were connected with the concussion specialist clinic in Winnipeg, I believe it was. And because of this virtual connection, if someone had a concussion in the study, they received care in 2 days, as opposed to having to travel to Winnipeg, get an appointment. So it improves access of care both in timely access and geographical access. It's convenient to the client. So they don't have to worry, again, they don't have to worry about travel. They don't have to get a babysitter if they have kids. They can log in from the comfort of their own home. They can, ask the questions they need to ask. They can have that session and then continue on with their day. Cost savings is another big one. And I don't mean cost savings as in your appointment is less, because I don't do that. I mean cost savings as in those other factors that would contribute to them getting to an appointment. So again, that goes back to cost savings of time, cost savings of travel, cost savings of fuel, cost savings of sitters, whatever those things are, there's an overall cost savings as opposed to getting to the appointment itself. And then improved client engagement. So with telehealth, you are 100% an active partner with the person on the other side of that screen. So they have to be more improved they're involved in their care, they're more participatory in their care, which usually, at least in my world, equals better outcomes. So those are some of our benefits. So let's dig into, there's kind of 3 main categories of telehealth. Okay, so, and depending on how you practice, you might do more in one, you might do elements of all 3. But let's kind of identify what those three main categories are. So the first one is store and forward. So this is where you have the sharing of client medical images, documentation between practitioners without needing to actually physically meet the patient. And so this would be sharing of videos or things like that. And there was a study done earlier this year that looked at actually a group of Parkinson's individuals. So you can tell I work mostly with the neurological population. And what this study was is there was just videos sent to this practitioner to the neurologist every day for a period of days. They never actually met the patient, but they made clinical decisions and therapeutic decisions based on these videos they were receiving every day. And at the end of the study, they made changes in the treatment plan based on these videos. And at the end of the study, the clients still had improvements in their UPDRS scores, which is an outcome measure we use to kind of address the progression of the disease. So that would be a store and forward. Real-time interactive services, this is what most people think of when they think of telehealth. So this is interactive live sessions via a medium to connect the practitioner directly to the patient. And so this is usually where video conferencing comes into play, but this can also be things like apps that help you have a conversation back and forth with the client because you're still having that real-time interaction, okay? And then the third piece is remote monitoring. And this is where we're seeing a lot of stuff start to come out and how we can support our clients. This is also referred to as self-monitoring. It utilizes technology to monitor the client's health from a distance. So these are the three categories of telehealth. So let's look a little bit about tele optometry more specifically. So what are we calling it? When I started to kind of search and prepare for this presentation, I was trying to find some research studies and going to your associations. And these were the three terms that kind of kept coming up. So it was either telehealth, tele optometry, or tele eye care. So those were the three terms that were being used in the optometry profession. What is being said this is the Canadian and the American optometric or associations. So tele eye care has the potential to increase access to quality eye care throughout Canada, particularly underserviced communities. And the American one supports the appropriate use of eye and vision telehealth services to supplement access to high value, high quality eye and vision care. And you see again in that sentence, and I just love that it's put in there all the time, high value, high quality. So you are not, again, offering a lower standard of care. And it's really important for both the practitioner to understand that when they're going to do this, but it's really important for our clients to understand that you're getting the same quality of care virtually as you are in person. And there's a lot of studies out there, and I do have one from an optometry study that I'm going to share with you that show client satisfaction. Because we all know it might be one thing that the research says it's great and that it works, but if our clients aren't engaged in it and our clients don't want to do it, it doesn't matter. But the research is supporting, and all these satisfaction surveys that are doing, there is a high satisfaction of both the feeling like the issues are being addressed through telehealth, as well as the overall experience. So these are just a couple more guidelines from the associations in general. So telehealth services may identify risk factors for eye health, vision issues, and provide a linkage to diagnosis and treatment. You must have protocols for local referrals in place. And this, obviously, telehealth in the optometry world right now does not replace an in-person comprehensive eye exam. In the physical therapy world, I can do an initial physical therapy assessment via telehealth. Some of that's based on insurance providers. So it's always a key to check in with your own association and your own insurance on any kind of nuances in the guidelines and recommendations that they talk about. Every area is going to be just a little bit different. So these are just a couple of the guidelines from the associations. So let's talk about how telehealth is currently being used in optometry. So one, it's being used for screening for disease. Two, for evaluative or diagnostic purposes. Three, for consultative or second opinions. And then four would be rehabilitative. 1 through 3 is what you see a lot more of. And I would say that's definitely more your primary care optometry. 4, whereas rehabilitative, that's the group that I work with. So that's the group that are more in Canada, we call them our neurooptometrists. In the United States, we call them our neurobehavioral optometrists. But these seem to be the 3 ways where telehealth is currently being utilized in the optometry space. So this was a study that was done in June of 2020 this year from the Institute of Ophthalmology and Vision Sciences Journal. And the goal of this study aims to evaluate if the Tele Optometric exam experience is non-inferior to the traditional in-person comprehensive eye exam via post-exam surveys. Now, I do want to say the way this study did this was a bit different in terms of what I typically think of as telehealth. So in the vision space, there seems to be at least two platforms that I found that are marketed to optometrists. So you have Digi Optometrics, which is where someone will still go to a location and a technician kind of uses some of the equipment, but the optometrists themselves are virtual. Okay, so this study was done in that sort of format. So someone attended a location, they could just walk into a location and a technician I don't know what your guys' equipment is called, but would put them through the assessment. And the optometrist themselves was the virtual component. Okay, so that's how this study was done. And so that's Digi Optometrics. So that's one platform that is very much marketing themselves to optometrists. The other platform is iCare Live. And it is not using this platform. So it is a purely telehealth, the way I think of telehealth tool. And it looks at disease screening, it looks at dry eyes, it looks at a few different things, but it as well is marketed specifically to optometrists. You don't need to use either of those platforms if this is an avenue you want to take your clinic. And you'll see, if you go investigate, then you'll see why. You become part of their team and on their resource of physicians. It's not your own, as far as I can understand by looking at them, it's not your own kind of integrated into your clinic. Okay. So regardless, this is one way telehealth is being utilized in the optometry world. And in this study, the initial experience for patients were positive or comparative to that of the in-person gold standard. 96.67% of people felt that the teleoptometric exam addressed their concerns, and 73.3% rated it as positive, which is fantastic. That's a fantastic number. What I like to say to everybody that I teach, that I instruct when it comes to telehealth is do not be afraid to be creative and think outside of the box a little bit. Obviously, you need to operate within your scope of practice. You need to operate within your ethical standards. You need to operate within your bylaws and all your rules and your regulations. But don't be afraid to be a little creative. Don't be afraid to, I say, challenge the system a little bit. And don't be afraid to think about something you could offer your client outside of what is the norm. Okay? All right. Moving on. Like whirlwind introduction to everything today. Concussion. This is my happy place. So a concussion is a complex pathophysiological process. It is a metabolic, microstructural, and physiological kind of component resulting from a biomechanical force that causes a functional neurological disturbance within the brain. Let's kibosh a couple of myths that I still see pop up all too often in the world. You do not need to sit in a dark room until your symptoms disappear. In fact, if you do that, you are setting yourself up for a longer recovery. You do not need to hit your head to get a concussion at all. That biomechanical force simply needs to cause an acceleration-deceleration process or whiplash process, which will then equal the concussion, could equal the concussion. You do not need to lose consciousness. And in fact, only a very small percentage of people actually do lose consciousness that are diagnosed with a concussion. It does not just go away. So the whole thing of you got your bell rung, shake it off, get back out there. We don't do that anymore. We know that if you reconcuss yourself in this period of this metabolic cascade, that is where you are at risk for things like second impact syndrome and more serious disease and more serious injuries. And the old one that I still hear too is that you don't need to wake someone every 2 hours if they get concussed. So what is important to know is that symptoms can be delayed in appearing. So most of the time, there will be some sort of symptom that will show up fairly quickly, but they can be delayed for hours. And for some people, depending on when and how much they kind of push themselves in that period, they might also be delayed for days. So general signs and symptoms, so we're going to go through a few categories. So there's physical signs and symptoms. So this would be things like your headaches, your dizziness, your light sensitivity or your sound sensitivity, nausea, vomiting, You could obviously have neck pain, blurred vision, double vision. All of these things are going to fit into the physical category. So we know concussion is multidimensional, which means it doesn't just affect one thing. And you could have symptoms from all of these categories we're going to talk about, or you could have symptoms from one or two. There is no rhyme or reason. No two concussions are the same. Okay, so we need to be aware of the scope of what concussion can affect. Cognitive symptoms. So this would be someone feeling slowed down. You might notice word finding issues or speech issues. They might be having memory issues. They talk about brain fog, or something doesn't feel right, slower reaction time, a hard time processing. Reading can become issues for people as well, comprehension. Okay, so these are some of the cognitive symptoms that might be coming out of a concussion. Behavioral as well. So this is things like they could be withdrawn for one thing, so you could think depression, anxiety type things, symptoms, or it could be uncontrollable emotions. So they're good 1 minute and then they're crying the next. Uncontrollable tears, irritability or anger, apathy, flat affect. All of these things can come into play with behavioral components of concussion. And then the last one we're going to talk about is sleep. So sleep, this is a huge range, but can affect the stats, say between 30 and 70% of people who have concussion. And this can look like you have trouble falling asleep, you have trouble staying asleep, you sleep at really awkward times that don't necessarily make sense, or you kind of don't sleep at all. So that's how sleep can be affected. So these are the kind of 4 main categories of symptoms that people can experience, and they can start to experience them obviously right away or days after. So looking a little bit more into vision, very broadly. So concussion effects on vision, absolutely. And this is where, dependent on these issues, we work really closely with some of the neuro-optometrists in my town for our client care. So we are using eyes and eye tracking so much in the research to help even identify that a concussion has occurred, right? So we know that we could potentially start using saccadic eye movement. There was a study that just came out that combined I use the right eye system in my clinic. So it measures saccades, it measures smooth pursuits, it does reaction time stuff. So they have a suite of tests in this program that lets people, it's called the Brain Health EQ. And they just used this suite of tests to do a study to see if they could use it to help diagnose a concussion. And what they found, I think there was I feel like it was almost 73% of people that they could diagnose with this, they felt that they could diagnose with this suite of tests because of the findings comparative to normative data. Okay, so we're using eye tracking, we're using eye movements to help diagnose this, and optometry and its role in vision and eyes is, important. So 3 kind of ways that concussion will affect vision. So those functional visual issues. So this is things like the actual task of actual oculomotor tasks. So you're looking at saccades, looking at smooth pursuits, looking at fixations, looking at convergence insufficiency. And convergence insufficiency is one of those things we can use as a prognostic tool as well to think that, okay, this might take a little bit longer to recover. Accommodative issues, all of these things get affected with concussion. Then you have perceptual issues. So you start to look at things like midline shifts and all that sort of stuff is perceptually. And then I just put dorsal stream. I clearly forgot a word. But when we look at our dorsal stream of vision and that parietal lobe and that spatial, right, as opposed to the fine detail, which is as opposed to the ventral stream, what happens is people collapse out their parietal, like they collapse out that peripheral field. So they become so hyperfocalized that they're trying to, in essence, use that ventral stream for everything, which leads to headaches. Because why would you want to use a fine detail system to try to see the world around you every moment of every day, right? So doing that visual field testing, seeing if they are actually losing parts of their visual field, and then working with you to try and open that up. And how do you do that? So these are definitely 3 areas. That's where balance comes into issues a lot too. If they've really collapsed out that dorsal stream or that parietal field, balance will become affected there, headaches, there's a bunch of stuff that fits into there. So these are kind of 3 categories when I think of what I look at in terms of vision too. that optometry comes into play. This is where it gets a bit tricky because you have people like me who are trained in a whole slew of these different areas that I will do some of this on my own. But if there is a big, like if there's big discrepancies in the visual system, that is something that I will always refer out for. If we have if there's binocular visual issues as well, that gets referred out. If there's a big midline shift, I'm going to pull to my optometrist and ask if maybe we can pull some lenses in to help us with that. Right? So identifying as a profession where neurooptometry is strong or where optometry is strong, if you're doing this rehabilitative piece of things and working together to support this client can just make their care that much better. All right, almost done this part and then we'll head into some questions. So how do we start to link it together? So telehealth, concussion, optometry, the research supports all three. It supports the use of telehealth and concussion. We're starting to see more telehealth in optometry, and therefore, ideally, we get to see more of the role of optometry in concussion, and we are starting to see studies around that as well. So how can you help as an optometrist? These are kind of the three areas I would say. Number one is awareness. So even if you are a primary care provider and you have zero interest in helping in the rehab side of working with a concussion client, just understanding and recognizing how the visual system can be affected by concussion is important, because then I can identify that there may still be something that's happening even though their clarity is 20/20. And this is what I see a lot of the time is people have blurry vision or whatever it is, and they get referred to an optometrist and they're like, optometrist says my vision's 20/20 and I'm fine. There's nothing wrong with my visual system. Visual clarity, as you know, is one piece. That's like one little snippet of it. So if you are a primary care provider and you don't treat concussion and you have no interest to, I'm not asking you to do that, but I am asking you just to have awareness for how concussion can be affected, how vision can be affected with concussion, and then recognizing that maybe educating the client on that a little bit, or just referring out to a colleague as well. So that would be one way. Number two would be lenses. Lenses are completely outside of my scope of practice, so I don't even go there. This is always a referral out to optometry for me. So, but exploring the use of various lenses to help that concussion client. So do we start looking at prisms? Do we look at blue blockers or other tinted lenses like the FL40 Can we bring these things into play to help support our client and manage symptoms? And again, that's a referral because it's not within my own scope of practice. And number three would be rehab. So are you someone who's interested in having that longer investment with the client and helping them on that journey with doing something like vision therapy? There is still mixed evidence to support it. I have clients who do amazing with it. I have clients who don't do very great with it, but I have clients who do amazing with me and other ones who don't as well. So there is definitely some research coming out more to support vision therapy, which is great. The programs are typically always provided by optometrists, and it's a longer investment with that client, but it also does let you work more in a multidisciplinary approach with your clients as well. And the people that I see doing more telehealth are those that are involved in a bit more in the rehabilitative space as well, simply because it gives you more versatility and diversity in your practice, I think, as well, to be able to utilize that telehealth platform. Next steps, just start. As I think as professionals that we have this thing that we want to fully understand everything and we want everything to be perfect before we try anything. And you are always going to be refining and fine tuning in everything that you do. And so if this area interests you, whether it's just the telehealth that interests you, whether it's the concussion stuff that interests you, find a way to get started. It doesn't need to be perfect off the beginning. You know, I'm big on being transparent with my clients. In my course, which you're going to see I'm going to talk to you about in a second, in my course, I tell all my students, share with them that you're just leaping into this piece of telehealth. Share with them that it's new for you, but share with them why you're doing it. Because if they understand the why, if they understand you're doing this so that you can still support them, so that you can still use this as a vehicle to help their healthcare, so that you can help screen their eyes so you can see things potentially like glaucoma and diabetes sooner to improve their care, they're going to be on board with you. And if you make a little mistake, they're not going to care. Okay, so always making sure you have that why and share that. Be transparent with your clients, but just get started. So I do a telehealth mastery course. What it does is it guides you through a step-by-step process of how you set up your telehealth practice, so it integrates seamlessly with your current clinic offerings. It is definitely, there is more of a rehab component to it, so I walk you through the website stuff and all that stuff too, and then there is a rehab component to the course as well. And as part of Vision Science of this presentation too, there's a promo code if you want to write that down, that you guys get a little bit of a discount. So that's all I'll say about that. Thank you. That was my whirlwind presentation for you on telehealth, concussion, and optometry. This is my contact information. So there you have my email, my website, and then my Instagram handle. Feel free to reach out at any point if you have any questions. I'd be happy to answer them. And yeah, thank you so much for listening. And I know we're going to do some
Thank you so much, Natasha. Your presentation and the way you presented it was so inspiring, and I was thinking, wow, this telehealth can help us as an eye care practitioner so much, especially for a person like me, where I am just living in part of the world that I don't have access to my patient. Even I'm not allowed to practice in this country, but with telehealth, I can just contact with them. And we have low vision patients, and my colleagues might be knowing, they are just disappointed patients, and they just wanted to come and see us, but in especially in government hospital, they don't have access to us. And if they know, just by clicking a button, they can just see us and we can help them, it could be amazing. But unfortunately, we don't know lots of knowledge about how to work with telecare and telehealth, so we should actually come to you, really. And it actually, telehealth make life very easy for us, for we and our patients.
It opens
And
up the way it opens up your opportunity, right? So the other thing too is, so many of us as practitioners all together, um, we're tied to our brick and mortar clinics, and telehealth takes away. I don't get me wrong, I love my in-person stuff as well, and I practice a hybrid model. So I have clients that are in person and we'll do some of their stuff in person, and we'll do some of their stuff telehealth. I have some clients that are 100% telehealth, and I have some clients that don't do any of it. But it provides you that opportunity to not be tied to a brick and mortar location 5 days a week, 7 days a week, 40 hours a week, whatever it is. So, I mean, I have goals to travel with my family and I can still work. Like, I can set a little bit of time aside if I want to go on an extended trip, and I can still see my clients. And yeah.
And sorry to interrupt you, but whether we want or not, the life is just going to be virtual. So why not we just prepare in advance? Maybe all the clinics, most of the things that just limited, the face-to-face patient and doctor will be just in emergency case and surgery. And we are just the healthcare, so we can just do maybe most of our service to our patient by telehealth. Why not?
The world is, we're going to see it more and more. And the way I look at it now is you can jump on the boat with the teams that are the people that are really embracing it now and starting to like blaze that path a bit more. If you don't do it at some point, I think you're going to be left behind in some capacity.
Yes. And I would like to start my question to you, and I will ask the listener, if you have any question, please write down in the chat box and I will ask on behalf of you. So the first question from you is, Natasha, could you please tell us about your professional life journey, about all your ups and downs, which will definitely encourage many of us to not to give up in difficult time?
Yeah, so I've been a physical therapist for, this will be 9 years. And I graduated from the University of British Columbia. And when I graduated, I still do have student loan debt up the wazoo. And so when I started, I actually worked in the hospital system, and I worked at someone else's, and then I worked in a private clinic in Vancouver, British Columbia. And I did that for, I want to say, about 2 years. And then I got pregnant with my son. So I went on maternity leave. And then while we were on maternity leave, we got transferred to Vancouver Island. So my husband is a first responder. So he's a police officer. So we got transferred over to the island. And when I came here, there was really nowhere for me to work. Right. I was a neurotherapist, and none of the clinics here, although they were great clinics, they weren't set up to treat the neurological population. So I decided that I should start my own thing. So I decided that I was going to start Symphony. And what it actually started as is a mobile business. So I literally carried a massage table and a hockey bag full of equipment around. and I drove to people's houses. I still had to get a startup loan for that because I didn't have any savings. And so I got a $10,000 startup loan, but for needing to get that loan, I needed to write a business plan, which I had never done before either. And so my son only would only breastfeed. He wouldn't take a bottle. And so there was literally a block where I said to my husband, there was a deadline I had to meet for this business plan. And I said, I need you to take a block off work because I just need to finish this. So for that entire block, what would happen is I'd wake up in the morning, I would go to the library, I would write for 2 or 3 hours. I would come home, I'd nurse my son, I'd go back to the library, I'd write, I'd come home, nurse my son, go back to the library, and then come home for the day. And I did that for like 4 or 5 days in a row, or maybe it was the 8 days in a row, to finish this business plan and then submit it. I was exhausted, but I did it and I got the loan. And so it let me start this mobile business of driving people's houses. No one knew who I was. Like, I was the new girl in town. No one knew who the heck I was. No one knew how I practiced as a therapist. I had to prove myself to this community. I cold called neurologists. I cold called physiatrists. I said, here's who I am. You want to meet me. I'm the new physio in town. I'm a neurological therapist. Your clients need to know who I am. I showed up at support groups and educated. I did a lot of free stuff to help get the name out there. And then I was able to open my first brick and mortar clinic 10 months actually after that started. And it was a small little like 800 square foot space. And again, no one wanted to work with me because no one knew who I was. But I had my first therapist joined me probably about 6 months after I opened, and then we outgrew that space, and now we're upstairs in a bigger space, and we are probably one of your leading clinic in concussion rehabilitation in the area. I do virtual care for people around the world and consults. Symphony is now, we have a team of 12. I think I have a team, and I just hired 2 more members. Not only that, I'm the co-founder of a company called Concussion Compass. So we support people with concussion symptoms, persistent symptoms from around the world in there. I teach people how to do telehealth. So I am constantly, as an individual, it's a lot. There's moments where it's hard work, and there's moments where, you want to throw your hands up in the air and walk away. But again, it always comes back to, why am I doing this? And whenever I do something, I never do it for a personal reason. Like, I love what I do, but there's always a mission behind it. We're serving this population, or we're helping these people. When I launched the telehealth stuff, it was, if I do this, I know people will not lose their clinics because they'll be able to keep their doors open.
Motivate you to just work harder and harder.
Yeah. So, it's been a bit of a roller coaster sometimes, but I love everything that I do. And I have, 3 businesses at this point.
Well done. Your hard work, really appreciate it. Thank you so much. And another question is, have you ever had any eye involvement? People, your patient suppose has some concussion, which eye also involved. And if so, how did you and your team deal with it?
Sorry, so like vision involvement with my concussion?
Yes.
Yeah. So all the time. So it is an incredibly common, so part of our assessment is the right eye, right? So we screen vision in every single client that we assess. So if I'm concerned about eye health, so if I'm concerned that there could have been like damage to a nerve or like a true nerve palsy or something like that, we immediately refer them out to an optometrist. And then usually that optometrist will then make that referral to ophthalmology if it's required. That's kind of how our system works. If it's something that the client is having a lot of binocular issues, so those eyes just are not teaming at all for whatever reason, that's something that I also refer out to a lot. The stuff that I will work on in clinic, at least in the beginning, is I will work on some of those saccades and that smooth pursuit, because then we do have training in that in my clinical neuroscience programming that I do, and in kind of the physical therapy piece. Especially just having that understanding of, what part of the brain drives this saccade, what part of the brain is more involved in smooth pursuit, how else can we bring these on board to help with the visual aspect. But if there's significant visual issues, and as well as some of the other vestibular and some of the behavioral, that's absolutely where building that team to support that client. And so there's 2 optometrists in my community, particularly, who are very active in the concussion community, and very active in that rehab piece. So we will refer out to them and work with them all the time.
Thank you so much. One question has come up for you, that what are the challenges or concerns which an optometrist might face in dealing with a post-eye concussion patient through virtual telehealth service?
Ooh. I think sometimes, I mean, you won't have access to all the tools, so you would have to figure certain things out. So when I think of some of the rehab tools that our optometrists use, they'll use kind of I call them flippers. I don't actually know if they're called
Yes,
flippers.
yeah,
You know what
yeah.
I mean, for accommodation.
Yeah, that's what it's called. Yeah.
Okay, the flippers. So they'll use things like flippers. They'll use this other kind of like funky lens thing. Sorry guys, this is my terminology piece. They use like another type of lens. I don't even know what it is. They use red green glasses a lot, right? With the red green. So if you're trying to do virtual care with someone with concussion, that person isn't going to have that equipment. So
Exactly.
if you need them to have that equipment, you're going to have to figure out a way to get that to them, whether you have basically whether you build like a vision therapy kit and they purchase that and it gets drop shipped to them, or whatever that is. But I think that's going to be your biggest barrier in the beginning, is some of the tools that I know our neurooptometrists love to use, the client won't have those. So you would have to figure out a way to get that to them. And then of course you don't have some of your actual tools that I know help you measure appropriately, like visual field loss and things like that as well. So with telehealth, this is where you kind of got to get and be creative and be okay with, if you can, at least in the beginning, not having all of that data the way you would, but finding a way that you could reproduce a test within that client's own environment so that at least it's still a little bit standardized to that person.
Right.
Yeah. And this is where, so I do have concussions that I've treated 100% remotely and had success. This is why I love the hybrid model though, so that sometimes I can have, if they can come into the clinic for an assessment, we can do that assessment. And then I have my data and I could give them a kit and then continue telehealth for the rest of it as well. But I've done both, but it's just navigating those pieces for sure.
Yeah. All right. Another question for you is, what is the diagnostic criteria of MTBI involving a traumatically induced physiological disruption of brain function?
How do you diagnose it?
Yeah.
So there's no test. So it's pretty much, it's a clinical diagnosis. I cannot diagnose a concussion. It needs to come from a physician or a nurse practitioner. But we're going on those signs and symptoms that we know can be involved. So very much the mechanism is very important of how it happened. And then you're looking at signs and symptoms, you're looking at the visual piece, you're looking at all those kind of categories we talked about. And if the mechanism fits, and if the timing fits, and there is demonstrating these symptoms of concussion, then usually they get that diagnosis. It does not show up on CT scan or MRI, right? So it's a functional disorder. You're not going to see things like bleeds. You're not going to see the level of damage. We know now that there's micro shearing and micro tearing within the axons of the brain, but a CT and an MRI doesn't pick that up, right? So if someone goes to the hospital, if they do get a CT scan, it is simply to rule out a more dire circumstance. It's not used to help diagnose the concussion itself. So it's very much based on the mechanism and then the symptoms that the person is presenting with.
The patient response. All right. Another question for you is, what makes your telehealth space special compared to all the others?
Oh, well, that's a good question. I've never been asked that one before.
I feel we did Natasha in telespace, nowhere else.
And you know what? I get asked this question a lot in terms of our clinic as well, because I've never done anyone else's telehealth stuff. I mean, I've done it with a clinical counselor. I think the way we've set ourselves up is it doesn't, and this is what I teach in my course. So it's introduced to them from the very beginning. It's never presented as an afterthought. You still get the same, obviously, you get the same considerations, the same care. If you're going to do telehealth, your client, your therapist has clearly explained why it's going to benefit you. But I mean, we right now use Zoom Health for our platform. But it's funny because I got actually someone messaged me the other day. They're like, how did you set up your waiting rooms? That's what we've been trying to do. Again, I teach you this in the course, but it's easy to access in the sense of you go to our website, you click a button and you're in. So the course that I created is built off my practice. So, it's teaching you the 5 pillars that I think you need to have a well-run, integrated, presentable, easy to access clinic, telehealth clinic for your clients. And then truly it's how you present yourself and bring yourself to the table. So I will be honest in saying not every therapist is meant to be a telehealth therapist.
Exactly, right.
Right?
It
Like
needs passion, it needs sympathy. You just have sympathy with your patient. Yeah.
you need to be able to build rapport, and you need to be able to do it through this medium. You need to be able to think on your feet, because things aren't in your imminent space, right? So not every therapist is meant to be a telehealth therapist. And I think that what my team does and what I do is we're really absolutely great at building that rapport, but we're great at delivering an amazing session through the screen, that there's no hesitation to book a telehealth session again.
Yes, so. Right. And the last question from you is, do you have any message or advice for those who are watching us now and those who will be watching you in the future?
Try it. Honestly, like I never thought it would be a pandemic that made telehealth happen, to be honest. Thank gosh I did it when I did. It's kind of one of those things, but I do think it will never replace in-person care. It'll never take the place of it fully, but it's not going to go anywhere either. And it's just going to continue to evolve and develop. And if you step your foot into the water now, you will evolve with it and learn along the entire process, as opposed to trying to dive in years down the road when it's kind of elaborate and involved. So I'm someone who likes to be part of the journey. I get so much joy in seeing things grow and change. And I think you learn so much about yourself as a practitioner as well, as you're starting to kind of evolve and do this field too. So I would say, just if there's any inkling of you that was inspired a bit by this presentation, that was like, oh, this might work, look into it a bit more and don't be afraid to give it a shot.
Yes. Thank you so much, Natasha.
Thank you.
Okay. Thank you again and for your valuable input on this subject. And I would also thank you, all the listener, for listening and hopefully being inspired by Natasha. And the quote of the day from Natasha is, don't be afraid to be creative and think out of the box. Don't be afraid, guys. And please keep checking visionscienceacademy.org for any updates and future information regarding this and many more interesting subjects. Guys, stay safe and try to be creative, especially in pandemic, which is very boring to stay at home all the time. Thank you, Natasha, again.
Thank you very much.
Have a nice day. You're still at night, I think.
I will. It is 7:55. I have my whole day ahead of me.
Thank you so much. You just put all the effort for us. Really appreciate it. Thank you.
My pleasure. Have a good day.
You too. Bye.
Bye.